The following videos will introduce you to our Avatar hip replacement program and how to get ready for surgery and what to expect and do in the postoperative recovery process. Thank you for entrusting your care to us for your hip replacement. As a practice that specializes in joint replacement surgery, we have built a comprehensive program called Avatar that is designed to facilitate the recovery process and improve outcomes. Our team of physicians, physician assistants, nurse practitioners, and office staff are all highly dedicated to the Avatar process and to our patient's end result. This manual is your guide to the Avatar hip replacement program and is meant to help you prepare for surgery and maximize your recovery. If you have any questions that require further information, please contact us at any time. Now we will introduce you to hip anatomy, arthritis, and replacement. The hip is a ball and socket joint. The ball sits on top of the femur bone. The socket is part of the pelvis. Cartilage covers these surfaces to provide a smooth gliding surface. In addition, there are key tendons and ligaments that move and stabilize the hip during everyday function. Hip arthritis occurs when the cartilage that forms the smooth gliding surface of the joint wears away and exposes the underlying bone. This results in pain and stiffness. Arthritis is a progressive process that worsens with time and has no medical cure. This X-ray shows both a normal and an arthritic hip. The arthritic hip shows bone on bone between the ball and socket and bone spurs building up around the edge of the hip socket. What is a total hip replacement? Hip replacement resurfaces the worn joint with implants affixed to the bone. The implant consists of 4 pieces. The acetabular implant, or the hip socket, this is made out of titanium. The bearing surface, which sits inside the acetabular implant and is made of polyethylene. The femoral head, which is made of ceramic or metal, and the femoral stem, which is usually made out of titanium. These implants are press-fit into the bone after careful preparation to ensure the best fit and alignment. Your surgeon will choose the implant size and type that is best suited to recreate your anatomy by templating your X-rays or a process of blueprinting as seen in the image below. There are many different hip systems on the market, including many different implant designs available. All of these are FDA approved and have successful track records. Your surgeon will choose the implant that is best suited to give you a successful result with low complication risk. All of the implants that we use in our Avatar hip replacement program have an excellent long-term clinical track record. Now a little bit about surgical approach. There are several different surgical approaches to hip replacement, and there has been much debate in the literature and press regarding whether one approach is better than any other. After decades of debate on this topic, the consensus is now that the surgical approach does not impact the time to recovery or the end result. All modern approaches are tissue sparing. We most commonly use the mini posterior approach and use the anterior approach in select cases. The optimal approach is the one your surgeon chooses for you, as there is no compelling scientific evidence that choosing any one specific approach over another will impact your outcomes. The following are general guidelines for when a hip replacement is appropriate. The level of pain is moderate to severe and significantly impairs your activity level. You find yourself avoiding certain activities that you would otherwise do because of pain. You have maximized conservative measures like medications, injections, exercise therapy, etc. And your quality of life is sufficiently impaired to warrant the surgery and recovery. What about expectations after hip replacement? The main goal is pain relief, and 90+% of patients will achieve good to excellent results when it comes to this measure. Some patients, particularly those with back arthritis, may continue to have some discomfort around a hip replacement. A small percentage of patients, less than 5%, continue to have moderate pain after hip replacement despite what appears outwardly to be a successful surgery. The reasons for this continued pain are not always clear, but may be due to implant loosening, scar tissue, infection and bursitis, or tendinitis. What about range of motion? Most arthritic hips are generally very stiff in rotational range of motion, and surgery will greatly improve this. Range of motion can be affected by other issues such as lumbar spine arthritis, body habitus, and severity of the preoperative arthritis. In terms of return of function, hip replacements are very durable and generally permit patients to return to a high level of recreational and physical activity. Biking, hiking, racket sports, skiing, and other sports are permitted provided patients achieve the necessary level of strength and range to permit this. Repetitive impact activities such as distance running are generally discouraged due to the risk of premature wear. Hip replacement sets the stage for patients to return to desired activities by performing rehabilitation necessary for each activity. Now let's talk about leg length. Many people with hip arthritis have a leg length discrepancy. This can either be a true discrepancy from cartilage wear and bone erosion, meaning the affected leg is actually shorter, or it can be an apparent discrepancy from soft tissue contractures around the joint or scoliosis in the lumbar spine. In these cases, the legs are actually the same length, but the affected side may appear to be slightly shorter or longer due to these conditions adjacent to or outside the joint. This image shows how tight muscles around the hip joint can tilt the pelvis and result in the appearance of a leg length discrepancy, or, as discussed above, an apparent leg length discrepancy, not a true one. One of the goals of hip replacement surgery is to restore the true leg length, not the apparent leg length. This is done by digitally templating each patient's case prior to surgery to determine which implants will best restore anatomy and stability. Leg length can be adjusted during surgery using different hip stems and head lengths. Another key goal of surgery is a stable hip that does not dislocate. This requires optimal soft tissue tensioning around the joint. Occasionally, to achieve this goal, it is necessary to lengthen a patient's leg slightly. If the leg was shorter before surgery, this sometimes just returns the leg to its normal length. Small amounts of lengthening are typically well tolerated and often not noticed by patients. Larger amounts of lengthening may be noticeable and can be treated with a heel lift in the opposite shoe. When a hip replacement results in the correction of an apparent leg length discrepancy, the operated leg may feel longer even though it is the same true length. We encourage patients to wait at least 4 to 6 months after surgery to let their spine and pelvis adjust, as this often corrects the perception of leg length discrepancy over time. Thank you for entrusting your care to our practice. We take great care to ensure the best possible outcomes for our patients. Our Avatar program has been refined over the years of experience with 3 main goals: less pain, better function, and faster recovery. For any specific questions, please reach out to us at avatar@kneehipshow.com.